There's a lot that I think women and practitioners don't know about autoimmune thyroid or even just hypothyroidism in women who wish to conceive and are pregnant. So if you're wanting to become pregnant, you absolutely should have a full thyroid screening panel. And I actually put together a handout that I'll talk about a little more at the end, but I put together a whole handout at drbrighten.com/labs that are all about like preconception labs that you should be thinking about if you do have an autoimmune thyroid condition, but I think every woman should be looking at these things. So you definitely want to get a full screening panel done. And the reason for that is that we know that if you have elevated anti-TPO antibodies, so those are the most common antibodies in Hashimoto's that we see elevated, that's the immune system basically tagging, flagging the cells in your thyroid to tell the T cells to come over and destroy them. So it's not a good scene. But I know some people, they ask, well, my thyroid labs are normal, but I have elevated TPO antibodies. Well, elevated TPO antibodies are associated with a 2 to 3-fold increase in miscarriage. So if you have anti-TPO antibodies but the rest of your thyroid looks fine, you're still at risk for a miscarriage. And if there's an autoimmune condition taking place, then there's inflammation, and inflammation is not good for pregnancy. It will disrupt the HPA axis, so what the brain is saying to the adrenal glands. And if we think about, you have your thyroid, your adrenal glands, and your ovaries, they're like a 3-legged stool, and if any one of those gets off, they all start to falter. The thyroid is really in tune with the sex hormones and with the adrenal glands. And so if your thyroid levels are off and you don't have adequate thyroid hormone, then we can see that you don't get signaling to your ovaries to produce progesterone the way that you should be. In a lot of autoimmune thyroid patients, we will see estrogen dominance taking place. And as estrogen rises up, so does a protein called thyroid binding globulin. And that will bind your excess thyroid hormone. Well, I'd say your thyroid hormone. It doesn't even have to be excess, which can then make it problematic because then it will then cause higher levels of estrogen again. We'll see dysregulation in cortisol levels, and all of this, in a woman without autoimmunity will lead to difficulty with conception and retaining a pregnancy. But the other thing that's really special about the thyroid and why you should always screen for it before you become pregnant is that it's been well recognized, and the American Thyroid Association actually put out a publication. Anybody can Google that, autoimmune thyroid and pregnancy, and look at the American Thyroid Association's recommendations. It's a huge document. And so for any woman listening right now, if your doctor's pushing back on you about your thyroid, this is a good document to download and take with you. Because what they stated in there is that any woman who has a TSH above 2.5, so that's the thyroid stimulating hormone, what the thyroid says to what the brain says to the thyroid gland, any woman with an elevation above 2.5 should absolutely be put on levothyroxine. That's a synthetic T4, and they actually recommend that you just start on 50 micrograms and you get those levels down, especially if the woman is already pregnant. So, to me, in my mind, if any woman who wishes to conceive shouldn't have a TSH greater than 2.5 because she's at risk for miscarriage, which I should say miscarriage alone can trigger autoimmunity in women. But, in my mind, if we aren't supposed to let a woman who wants to have a baby go above 2.5, why are we letting all other women go well above 2.5 and have symptoms? And, that's just not my practice, but it's something I, just want to make that point that if you want to become pregnant, your doctor will medicate you if you're above 2.5 on your TSH. But if you don't want to become pregnant and you're at 3, they'll just kind of let you go with that.